Hello everyone, I'm Dr. Apeksha. I'm an obstetrician and gynecologist. I'm having almost 15 years of experience in this field, and I'm passionate about my profession because I want my women to be fit throughout her life, and that is not only during the pregnancy but also during her reproductive age group, after menopause. And she should be fit not only from the other health related issues but also from the cancers which are very common nowadays, and that is the breast cancer and the cervical cancer. బేసికలీ బ్రెస్ట్ క్యాన్సర్ చెప్పాలా అంటే చాలా మందికి ఏం తెలుస్తుంది అంటే జస్ట్ మీకు ప్రాబ్లం ఉంటేనే హాస్పిటల్లో వెళ్ళాలా, డాక్టర్ దగ్గర వెళ్ళాలా, లేకపోతే మీకు రెగ్యులర్ చెకప్కి అవసరం లేదు. బట్ ఇట్ ఈస్ వెరీ ఇంపార్టెంట్ టు అండర్స్టాండ్ దట్ nowadays breast cancer is second most common cancer amongst women, and that's why they need to know that when should they go to doctor, when should they do the regular checkup, how they should themselves do the regular checkup for related to breast cancer. And I am very much fortunate to tell this during this month of October, which is breast awareness month, వేర్ అందరు లేడీస్కి ఏం తెలవాలా అంటే డెఫినెట్గా ఆఫ్టర్ నాట్ ఓన్లీ డ్యూరింగ్ డెలివరీ ఆర్ డ్యూరింగ్ ద ప్రెగ్నెన్సీ బట్ ఆఫ్టర్ ఆల్సో they should go for self breast examination every monthly, and after that after the age of 40 they should go to the doctor every yearly at least to check their breast. That is called as clinical breast examination. And if the doctor feels that they should undergo scanning or mammography, which is scan for basically for the breast tissue, so if they go undergo that testing, which is not painful, which is not going to give them any sort of radiation exposure, so if they go for that, they can be diagnosed early. If the breast cancer or something like near to that if is developing, they'll able to understand and know it very early, which is very good time where we can treat the cancer patient. So that's why what I want to tell to all the women, that they should not only go for their regular breast examination every yearly according to the age by the guidelines, but also they should be aware that if they feel some breast lump, or that is ఏమైనా గడ్డలు ఫీల్ అయితే చెకప్లో, లేకపోతే నిప్పల్ నుంచి ఏమైనా డిశ్చార్జ్ ఉంటే మేబీ దట్ కెన్ బి బ్లడ్ డిశ్చార్జ్ ఆర్ గ్రీనిష్ ఆర్ milk discharge, because after breastfeeding they should not have even milk discharge from the breast, and even watery discharge, nipple retraction, and even a lump laga feeling even into the armpit, they should go for the checkup by the gynecologist or the respective their family doctor, so that that can be diagnosed early. So this is for the breast cancer as such, but also the first most common cancer, that is the cervical cancer, that everyone knows that it is very dreaded cancer. If it is diagnosed late, definitely most of the patient they will have more of morbidity, that is more of the deaths are common due to this cancer. So ఇలాంటి కోసం మీకు ఏం అవేర్నెస్ ఉండాలా అంటే, there are vaccine available for cervical cancer prevention, and it is the only vaccine available which can prevent cancer, and not only for the girls but it is also for the boys. So now the new update or guidelines, they say that it is not for the girls only that to be vaccinated. The cervical cancer vaccine should be given to the boys, and if you give this vaccine between 9 to 16 years of age, that will be only 2 doses, and that too it will lifelong will save these girls and boys from developing this type of cancer. So not only for 9 to 15 years of age group, but also after that till about the age of 40, this vaccine can be given. And that's why you should at least have the awareness that this type of vaccine is available, and you should ask your doctor, your family doctor, how to take this vaccine, how to prevent this cancer. Definitely there is screening test available for cervical cancer, that is pap smear test or HPV DNA testing, which your doctor will tell you how it is, but again telling you that it is painless, no pain is there during this testing. So please go ahead every 3 to 5 yearly. If you do this testing till the age of 60, you will be detecting this type of cancer in a very early stage, where it is totally treatable with just very minimal treatment. So no need of even very high level of treatment like chemotherapy, radiotherapy is also not needed. So this is my humble request for all of my patients and all the women listening to this, that please go to your gynecologist, your family doctor, ask about the availability of this cervical cancer prevention vaccine, and also go on doing the breast examination, not only by yourself, that is called as self breast examination, but also by your doctor, that is called as the clinical breast examination. And along with that, if they suggest mammography and ultrasound, please go for it. It is more beneficial to you and your life. With the experience of 15 years, what is my take home on this topic is, even government is doing lot of work related to awareness regarding this breast cancer and cervical cancer. Still we need a mass media involvement. We need some communication channel. Maybe it can be a media, it can be a movie theater ads, or somewhere in the TV channels we can give the ads regarding the awareness of breast cancer, how to prevent that. We can give the education to the mothers. Though doctors, they tell whenever the patient comes with the problem, but every time it is not possible that they go on telling the same thing repeatedly for every patient. So better to have a mass media level of communication, where everyone will get it through the channels, through the TV or media, or the movie ads, where they will be told about how you should protect yourself, and when you should go to the doctor, and when you should get treated for the symptoms what they are having related to breast or cervical cancer.